Hello everyone. Today we are going to be talking about healthcare. Healthcare is the maintenance or improvement of health of individuals through the following processes: prevention, diagnosis of the ailment, its treatment, recovery, and finally the cure of the disease. It is essentially the ability of individuals or communities to keep themselves safe from diseases, ailments, or any sort of injuries. In order to fulfill this task, healthcare systems are organized to meet the health needs of certain populations. Healthcare is a very important part of politics today. An efficient healthcare system can contribute to a significant part of a country's economy as well as its development. A well managed healthcare system can boost the productivity of its citizens and increase the economy's prosperity. Now, let us talk about the features of healthcare. Access to healthcare varies from countries, communities, and individuals. It is influenced by social as well as economic conditions, along with healthcare policies of individual countries. Providing healthcare services means that the timely use of personal health services to achieve the best possible health outcomes. Factors to consider in terms of healthcare include financial limitations, geographical barriers such as transportation costs, ambulances, etc., personal limitations such as lack of ability to communicate with the healthcare providers, low income, poor literacy, limitations to healthcare services negatively affects the use of medical services, efficiency of treatment, and overall outcomes, such as well being and mortality rates. In order to meet the health needs of populations, healthcare systems are established. A health system is essentially an organization of people, institutions, and resources that deliver healthcare services or health needs to target populations. Planning of health systems can either be central or market based. Central planning in healthcare system is mostly the prerogative of the government who runs healthcare on taxpayers' expense. Market based healthcare is dependent on private corporations who run healthcare institutes for profit. Irrespective of ownership, WHO states that any healthcare system must have two important things. First, a proper financing mechanism, and second, well trained and adequately paid workforce. Lack of a proper workforce can have negative consequences on the health of the people. A health system also needs reliable information and intelligence on which decision and policies are based. Same information is also needed in the field of procuring proper medicines and modern medical technologies. Let us talk about the types of healthcare delivery. First type is called primary care. Primary care refers to the work done by health professionals who act as a first point of consultation for all patients within a healthcare system. Example of such a professional would be a primary care physician such as general practitioner or family physician. A licensed independent practitioner such as a physiotherapist or a physician assistant or nurse will also come under primary care. Primary healthcare is usually for illnesses that are not extremely serious. These are illnesses that don't require advanced skills or specialized skills rather, or any sort of complex machinery. These procedures are also very less expensive. Some of the common illnesses that primary healthcare practitioners cover could be hypertension, diabetes, depression, anxiety, back pain, arthritis, and in some cases, even basic maternal and childcare services. Second form of healthcare is called secondary care. This includes acute illnesses. These are necessary treatment for a short period of time, but for a brief and serious illnesses, injuries, or any other health condition. This can be found in a hospital emergency department, namely an ICU. Secondary care is often synonymously used with hospital care. This is because secondary care requires a high degree of infrastructure that is simply not available in a primary care facility. Psychiatrists, clinical psychologists, occupational therapists, or dental specialists are also uh, considered secondary care specialists. Third form of healthcare delivery is called tertiary care. This is a consultative system which is for patients that have received a referral from a primary or secondary health professional. These are for serious illnesses that require advanced skills and equipment. Tertiary care is the one that is not easily available and can be given only if it is referred to by a primary healthcare professional, such as a family physician, or a secondary health professional, such as a hospital. In a facility that has advanced medical investigation and treatment is referred to as a tertiary referral hospital. Some examples of tertiary healthcare services are cancer management, neurosurgery, cardiac surgery, plastic surgery, etc. Next is the quaternary care. This is the highest form of healthcare that is available. It is sometimes referred to as an extension of tertiary healthcare in reference to advanced levels of medicines which are highly specialized and not easily available. Experimental medicine and practices, as well as some types of diagnostic or surgical procedures, are considered quaternary care. For example, stem cell research is rarely accessed and expensive, hence, it comes under quaternary care. Next comes community care. These are healthcare interventions that are delivered outside conventional health facilities. They can be of public health interest, such as food safety surveillance, needle exchange programs, etc. Community services can also deal with rehabilitation, such as re-attaining mobility after the loss of limbs. Availability of prostheses or wheelchairs is also done by community care services. Healing substance abuse disorders such as alcohols and drugs, as well as self-care, is also provided by community care infrastructure. Let us talk about healthcare systems in India. India has a universal multi-payer healthcare model. It is a combination of both public, that is paid by taxpayer money, as well as private healthcare, that is institutions run for profit. Public hospital system is essentially free for all Indian residents except for a few symbolic payments. At a federal level, a national publicly funded health program called Ayushman Bharat covers all Indian citizens. As of 2020, 300 million Indians are covered by some sort of health insurance, either public or private, which is either paid for by their employers or by individuals. The total net government spending on healthcare is about 1.23% of total GDP. Rural areas have a serious shortage of medical professionals. 74% of doctors in India actually serve in urban areas, while only 28% serve the rural population. This is a major issue for rural people as they lack access to proper and quality healthcare. Lack of human resources also causes citizens to resort to fraudulent or ignorant providers, also known as quacks. Let us talk about the National Health Policy of 1983. The National Health Policy had three main points in its focus. First was that non-communicable diseases, that is, diseases that don't spread from people to people, like say malaria, are becoming a rising burden on the taxpayer. Secondly, it noticed that India needed a robust healthcare industry that is well financed and well stocked with modern medicines as well as infrastructure. Other objectives were achieving an acceptable standard of good health of the population, decentralizing public health system by upgrading infrastructure, ensuring a more equitable access to health service across the social and geographical expanse of India. It emphasizes on rational use of drugs as well as increasing access to tried and tested systems of traditional medicine. The policy noticed that Indians mostly pay out of pocket when it comes to healthcare expenditures. Private sector encouragement had worked, but most of healthcare expenditure had been private and not public. Public health programs made only 1.8% of total GDP. Now let us talk about Pradhan Mantri Jan Arogya Yojana. Jan Arogya Yojana is a subpart of Ayushman Bharat, which is a flagship scheme of Government of India launched in 2017. Its purpose was to achieve universal health coverage. Ayushman Bharat is divided into two parts: health and wellness centers, whose job is to provide primary health care, and second is Jan Arogya Yojana, launched in 2018 to provide secondary and tertiary care. This is the largest health assurance scheme in the world, which aims at providing a health cover of rupees 5 lakhs per family per year. Its aim is to reach families that are poor and vulnerable. Approximately 50 crore people are said to be their beneficiaries, who form the bottom 40% of the Indian population. Pradhan Mantri Jan Arogya Yojana is fully funded by the central government, and the cost of implementation, however, is shared 60-40 between the central and state governments. It has subsumed formerly known as Rashtriya Swasthya Bima Yojana, launched in 2008. Now let us solve a couple of multiple choice questions. Question 1. Which one of these is an example of primary healthcare? A. General physician, B. Family doctor, C. Both A and B, or D. Neither A nor B? Correct answer C. Both A and B. Primary healthcare is one that is the first point of consultation for any patient. Usually, primary healthcare is for illnesses that are not very serious and will not require specialized skills or equipment and medicine. A primary healthcare operator can direct a patient to higher levels such as secondary, tertiary, or quaternary. This will be only in case a disease is a disease cannot be diagnosed properly or is serious and requires specialized attention. Question 2. Which of the following is not a feature of Pradhan Mantri Jan Arogya Yojana? A. It is a part of Ayushman Bharat program. B. It has subsumed National Rural Health Mission. C. It provides insurance cover up to 2 lakhs. Or D. Both B and C. Correct answer D. Both B and C. Pradhan Mantri Jan Arogya Yojana is a part of Ayushman Bharat, which was launched in 2017. It is the world's largest universal health coverage scheme. It seeks to cover about 40% of the uh, bottom half of the Indian population, that is about 10.47 crore people. It has subsumed Rashtriya Swasthya Bima Yojana and provides insurance cover up to 5 lakhs and not 2.